Today we will kickstart our scientific session with the erudite Dr. Raghubir Banerjee, Professor of Dermatology at Ramakrishna, Seva, Pratisthan, Kolkata, presenting his talk on cleansers and moisturizers and their roles in infants and children. Over to you, sir.
Good morning, everybody. Thank you, Arpita, for the kind words. So, I'm the first bowler of the session. Before starting my deliberation, I convey my sincere thanks to Professor Dr. Sandipan Dhar, who is my mentor, my dada and guide in the field of pediatric dermatology, and my dear friend, Mr. Parthopal of Paulson's Drugs, of giving me the opportunity to be here in this meet. Well, I think it's a very important thing to discuss, cleansers and moisturizers, the role in the pediatric practice. This is a very unique meet where dermatologists are speaking to mostly a pediatric gathering. And this concept of Dr. Sandipan Dhar, jointly with Mr. Parthopal, is a very unique concept. And please give them a very big hand for conceptualizing this sort of an event. Now, the basic aim of skincare is to reduce trauma on the infant skin and to prevent barrier damage. So the integrity of the skin is maintained. So this is the basic motto or basic goal of a good skincare. Why we need to discuss skincare in children. Before going into the detail, the pediatric patients, they come to the pediatricians first and to the dermatologist later if they have any dry skin condition, if they're referred by the pediatrician. So you pediatricians have to guide the parents regarding the skin care of the child, what emollient to use, what cleansers to use, and because the market is flooded with baby products and all stamped baby products which the parents think are safe may not be safe to that extent. So the guidance from the pediatrician is very important regarding skin care of the child. Now coming to cleansers, why are cleansers so important? Even water can cleanse the skin, but all impurities on the skin are not water soluble. So a simple water cleansing will not do the job. We need something beyond to clean the lipid soluble impurities that are on the skin. So that is where we have substances called surfactants. So what are surfactants? They reduce the surface tension on the skin and remove the impurities which are lipid soluble to enhance the cleansing effect. So with water, what is not achieved, we need to add a surfactant to clean the skin. Well, the surfactant containing things are soaps and synthets or detergents. They are used to clean the skin. But we have to select a surfactant which will not damage the skin also. So the quality of the surfactant should be such that they will have a proper cleansing action without damaging or compromising the skin barrier. Now, regarding our cleansers, you have seen there are things little like baby wash, baby cleansers, liquid synthets. So what are they composed of? Is it only the surfactant or the soap? No. They have a body of a cleanser is, instead of the surfactant, they have structurant also, a little bit of perfumes to make it more acceptable, a little bit of moisturizers and humectants so that the skin does not become dry, and of course the preservatives and other additives and fillers so that the anatomy of the cleanser stays in shape. So a lot of ingredients go into making of a cleanser or a liquid synthate. Now coming back to soaps and synthate. Soap is of course from, you all know about saponification, and they are more of alkaline nature, and soap is a bit on the harsher side. Soap is there from 3000 BC, long time back. Synthates are the newer agents. They are the synthetic detergents which have the cleansing properties and less harmful on the skin, maintaining the skin pH, not damaging the skin barrier. Because the soap, which leaves the skin alkaline, can denature the protein, can damage the lipid bilayer, and so on. But the synthetes, they disintegrate a bit faster, but they are more skin friendly. This is in a nutshell showing you we are dealing with a newborn child, and as dermatologists, we deal mainly with the dry skin conditions after maybe the patient comes to us referred by a pediatrician. But the newborn child is usually a normal child, is the domain of the pediatrician. So in such circumstances, the parents will ask for advice regarding what soap to use, what oil to use, and so on. We prefer the mild synthetes because of the obvious benefits. They are less irritant on the skin, they preserve the barrier, they do not alter the pH much, and of course, the new generation of eco-friendly synthetes have also come up. What about soap? They have an excellent cleansing action, excellent antimicrobial activity on the skin, but they significantly alter the skin pH, they damage the barrier, they are capable of denaturing the proteins, damaging the lipid bilayers. So in a newborn child's skin or in a skin with dry skin condition, we definitely prefer something of a mild cleanser like a synthate than a normal harsh soap. This is again the pH. pH is more of, I'll not say a marketing gimmick, I'll be too harsh on that. But of course, the pH of the skin is mainly on the acidic side. You can see it's about 4 to 6. The synthate dwells in between neutral to acidic pH. And of course, the soap is strongly alkaline. That is why we will go with the synthate when we are talking about the newborn child's skin or a child with dry skin of ichthyosis or atopic dermatitis. Now, regarding the bath of the child, as you all know, as I have already mentioned, that soaps and detergents remove the oil and the lipid from the skin, and use of a moisturizer immediately after bath is recommended. Of course, oil, we use mainly the coconut or the virgin coconut oil and the sunflower oil, which is more useful for the infant skin. Initially, many people think olive oil is very good, it's very expensive, we use Italian olive oil and so on. The parents come and say, double lal tel, Italian olive oil. So these things we get. So here you have to counsel the patient regarding what oil to use also, so that they do not damage the skin barrier. Here you can see this is a cyclical process. If the skin is exposed to low-grade irritants, like excessive use of soap, बढ़िया से रगड़ के you go on cleansing the child, what happens? You induce more of barrier dysfunction, the transepidermal water loss is more, there is a fall in the water content, there is a damage in the lipid structure, and this goes on regarding in significantly compromising the skin barrier. This is another thing that as a pediatrician you have to make it very loud and clear. Antiseptic baths. I think in your practice you have patients bathing their child in Sudol, Dettol, Savlon, Japani mein, you put some Dettol and bathe the child. These are very, very common things that we do get from patients. You must also be getting it from the history from the patient. So this has to be very loud and clear message given to the parents that do not use this for routine cleansing. No Sudol, no Dettol, no Savlon in the water or in the child. So routine use of antibiotics and antiseptics on the skin of the child is a big no. So this message should be put forward to the child, the parents. Of course, with upmarket people, they use bubble baths. So what damage can a bubble bath cause? So the child is very happy, bathing for 15, 20 minutes, half an hour with the bubbles and all. So they will damage the skin more. Instead of a 5 to 10 minutes at the most a bath, with a bubble bath, you go on for a longer time. So this is something that we do not advocate. Regarding shampoos, patients will ask you regarding what shampoo to use because the market has so much of baby products. They are spoiled for choice. The shampoo, the basic thing should be, the pH of the shampoo should be near that of the tears, that is a neutral pH. And the shampoo should be viscous enough not to trickle down to the eyes and irritate the child's eyes. So these are two things you keep in mind when selecting a shampoo for the child. Now, the take-home message for cleansing is there should be a short time of a bath, preferably 5 minutes. Use of soft liquid synthets to clean the skin, and definitely use a moisturizer following a bath to prevent the dryness of the skin. Now, coming to the next important thing, moisturizer. So what is a moisturizer? Of course, it's a generic term which is used to keep this barrier repair, to prevent transepidermal water loss, to hydrate the skin. So these are all the elements that are there in a moisturizer. So we expect a moisturizer to do all that. So this is a very, very simplified diagram where you can see a healthy skin. For pediatricians, not for dermatologists, we have to say that these are the corneocytes, which we call the bricks. And in between this yellow thing is the lipid layer, the brick and mortar theory. So this is the stratum corneum, a healthy stratum corneum. And because of the healthy barrier, the allergens and the irritants do not penetrate much. Now what happens if this barrier gets disrupted? What we call the loss of skin barrier. You can appreciate that there is loss of lipids, loss of water, and the barrier has got disrupted. So what happens now is the irritants, the allergens, they penetrate very easily into the skin and damage the skin. Now coming to moisturizers. Moisturizers is supposed to prevent the barrier disruption. There are many types of moisturizers. I have divided it according to their mechanism of action. First, we have the occlusive. So, occluding meaning, see, like we use a polythene to keep it covered. So, what is the function of an occlusion? You prevent the evaporation of water from the skin, as simple as that. So, the skin has a hydrophobic film on the surface and prevents water evaporation. What we mean by that? So this is an water in oil type, more sticky, ointment based, covering the skin, preventing water loss. What are the examples? Wax, petroleum, and so on. The plain light liquid paraffin. What does a paraffin do? It will occlude the skin and prevent water loss. So this is one variety of moisturizers which is occlusive. Next is like a sponge. This is hygroscopic. They are supposed to absorb water, water from the damp atmosphere and water from the dermis. This is a humectant, hygroscopic substances which will bring outside moisture. They are suitable for dry skin. They are usually watered in oil. Things like glycerine, lactic acid, and so on are supposed to be humectants or hygroscopic moisturizers, which pull water from outside or inside the dermis. The next is emollients. What do emollients do? They're very soft moisturizers, can be used on normal skin. They will penetrate the intercorneocyte space so that the skin remains soft, flexible, supple, and moist. So this is the character of an emollient. Emollients, as you all know, are the plain mineral oil, lanolin, the fatty acids like linoleic, and oleic acid. These are present in oil also. So this is what the emollient does, keeping the skin soft, filling the intercorneal side spaces. So this is how the different moisturizers are supposed to act. But what we need in dermatology practice, we are dealing with dry skin, we are dealing with ichthyosis, atopic dermatitis, and so on. So any one moisturizer may not be sufficient for us. In such a case, we have a therapeutic emollient. Therapeutic emollient, it is supposed to repair the barrier. What are the constituents? We have occlusives, we have emollients, and everything in this, so that we have multi-pronged action to prevent the dryness. And of course, in atopic skin which is compromised, we need ceramides. Ceramides are an integral part of the barrier lipids. About 40 to 50% of the barrier lipids is of ceramides. And in atopic dermatitis, where we have less ceramides, a ceramide in a moisturizer is supposed to work and repair the skin barrier. So this is a therapeutic emollient where we have all these basic emollients to give us a desired clinical result in extremely dry, itchy skin. Of course, what I was talking about is barrier repair. This ceramide cholesterol-free fatty acids is the lipid bilayer composition, and at 3:1:1 ratio is maintained there, and if this is maintained in a moisturizer, it is supposed to repair the barrier, supposed to. Well, I've mentioned conditions with dry skin like atopy, ichthyosis, and psoriasis where need these therapeutic emollients. These are a few clinical photographs to show you the dry, itchy skin of atopy and ichthyosis. There are a lot of myths about moisturizers. So what are the myths? Are all moisturizers the same? Certainly not. Some say creams are more efficacious than lotions. So I'll say the use of the moisturizer will vary. They'll vary according to the climatic condition, the geographic location, what are you using it for? How dry is the skin? So this is something you have to decide. If it is very hot, humid condition, you use the occlusive moisturizer. It's not done. So according to the weather condition, according to the place where you are in, according to the condition of the patient, according to the area which is affected, the use, the selection of the moisturizer should vary. This is something, again, you have to tell the parents, and I think it's the duty more of the pediatricians. The baby products have flooded the market, and natural products. Dr. Saab, हम सब कुछ हिमालय का use करते हैं. This is the common thing I get from patients nowadays. There's something called Mama Earth also. I heard it the last time Rajiv was with me in the Ramakrishna Mission outdoor. The patient said, हम सब Mama Earth का use करते हैं. I said, Mama Earth कौन है? अपना मामा जानता है. Mama Earth तो हम नहीं सुना है कभी. So these are certain things we pick up in practice. Himalaya, Mama Earth and all. Are these products very safe? So I take it with a pinch of salt. They're supposed to be natural products. They fool the patients that everything natural is safe. Certainly not. These products are not tested at all. These are all marketing gimmicks to sell the product. As you can see here, that it has also been reported about photooxidative injury of the OTC products. So all natural products, all baby products which are OTC might not be safe. Well, look at the composition also. Things like triclosan have risk of toxicity. Glycerin can cause seizures. Boric acid is known to produce seizures or erythroderma. So the ingredients or the constituents of the moisturizers are very important. And before prescribing a product, you should be very well aware what is there in the product and what to expect in the child. Well, the baby product market is booming. It was millions in 91, projected to be billions in 20s. So there is a sharp rise, a sharp boom globally and in India. So as pediatrician, you should be very careful and tell your patients what to use and what not to. Well, thank you. Thank you for your patient hearing.